Welcome to the Take a Mulligan podcast with your hosts, Brian and Kenny Mulligan. We hope to encourage you not to quit and keep going. If you're at that place where you just want to stop and give up, don't. Second chances can happen. Try again and take a mulligan.
Well, welcome back to another episode of Take a Mulligan podcast. Thanks so much for being with us. On this podcast, we really try to discuss a bunch of different topics, and we focus on four main things of fitness, faith, family, and friends as a subtopic. And today we want to take on a subject that's near and dear to my heart based on my profession as a physical therapist and being in the medical field for a long time. And it really can fall under some of these subcategories of fitness and family and maybe even a little bit of faith. So today we're going to discuss a topic that may seem a little controversial to some, but hopefully more something to think about for most of you. And that topic is health and healthcare. So let's jump in. So Kenny, I know I'm the one that has had the career in healthcare industry, which is a bit foreign to your career path.
Definitely a little different.
But what's awesome is that you have had a lot of experience, some ways more than a lot of average people, as a patient in this space, and have, entered yourself into the space a bit with our work with this health and wellness company that we work together with, and now also being a certified personal trainer, which is new. So again, props to that. Congratulations. Proud of you for working hard to become that new chapter in your life and seeing where that goes. So as we jump in today, I think I want to just start off by saying I love what I do for a profession, and I love my living. I love my occupation. And I think I was really called into this profession and really drawn to it because I wanted to help people. And that's really the passion that drives me to do my best every day to help the people that I'm with. So I've been in the healthcare industry for, hard to believe, 31 years now. Since 93, I started in this world. Started in through high school or college age, all through college and stuff. So been in this space for a long time, seen a lot of stuff, learned a lot of stuff, talked to people all the time, that are suffering from things, talked to healthcare professionals, worked with a lot of different people, doctors, therapists, nurses over the years. So I have a lot of experience just in being around this world. So it's very near and dear to my heart. And I think as I've seen things change over the years, it really became obvious to me that the healthcare world is very different than where I started from. So, Kenny, you have an interesting health journey. Most of your life, you've been dealing with some health issues. What is your first impression of your experience as a patient in the healthcare system since you started when you were young, right? You were high school age when you started having some.
Oh my goodness, probably before then. Oh my goodness, I think I remember just being a sick person. I don't know how to describe it except being sick. I went from one thing to another. I remember as a kid. Oh man, I was young, and I remember I kept getting these side pains all the time, right? And then I'd go to the doctor, and he'd feel around. It's like, well, it's not appendicitis, and maybe some of it was because I remember our cousin David had appendicitis when I don't know how old we were, like second grade or third grade. And they rushed him to the emergency room, and like it had already burst. And so I had this fear in my mind, so any pain in my side was like one of those things. And, but so I had this pain that wouldn't go away. And finally, mom and dad decided to let's go down to Philly. And they went down to the Children's Hospital in Philadelphia. And so this is my first experience like with a big hospital, because we come from a smaller, it's not a small town, but it's Trenton, New Jersey. You go to a local doctor, it's that kind of thing. It wasn't a big city hospital, right? And they went down there, and within hours, they diagnosed me with what was wrong going on, right? And basically, I was just constipated. Like it was a little kid, kind of thing, right? And it was just basically all wound up kind of thing. And it was just after a while, and this went on for months. So it wasn't like, things weren't working and stuff like that. It was just, I don't know. Can't go into all the medical because I don't know at all. But I remember like, wow, okay, so if you ever have a problem with one of your kids one day, and the local doctor's like, I'm not sure what this is. It's like, okay, you had your shot. Let's go to the big guys, right? And I still have that philosophy today. I still, like, if there's something you're not sure about, it's like you call the big guys. And so that was my first introduction into, like, I guess, going to a doctor and trying to find answers. and I felt for the first time like those big guys, like they search for answers. I think that's what amazed me about that. And then our sister Denise had some medical issues too with mom, dad. What they do? Took her to the University of Penn. It was the same kind of thing. But so growing up as a kid, I also had this thing where I would just get weak. Like I'd be like out in the backyard or something, and all of a sudden I just get weak. Like, and I couldn't explain it. I come in to mom, I was like, "What's going? Are you okay?" Like, no, I just feel weak. And I guess now you might look back, say like an iron deficiency or something like that, but it probably was an onset of what we're going to talk about a little later on, but we just didn't know it then, right? So, but that's what it was, okay? And then I think in, what was it, sixth, seventh grade, I know I had mono in high school, so I went through that, and then I had spinal meningitis. Oh my goodness, that was like
scary for that.
And that was like I woke up in the morning and my neck was stiff and like not a whole lot of other symptoms, just like this is really weird. And it was like maybe I had a slight fever or something. So mom was like, okay, we'll take you to the doctor. And I were going to the doctor and they were like, okay, we're taking it right to the emergency room. And they were like, what? Is like, and he did a few like tests in his office or whatever. And I was like, oh my goodness. And they quickly did a spinal tap, which was a nightmare from hell going through that. Because that's where they pull the fluid out of your spine. You know, so they stick this huge big needle in your spinal cord and pull these fluids out. And it was like 2 hours it took them to get it out of me, right?
There was that when we were down the shore. I remember you going to the hospital when we were down the shore on vacation. Was that the time?
No,
Yeah,
that was for something else.
Right.
Like I said, I felt like I was sick all the time as a kid. I just felt like there's always something wrong, always something wrong. And
how many times did they stick me for that spinal meningitis?
Oh my goodness, I still remember to this day. It was so bad. My mom and dad said the nurse walked out of the room because there was just so much blood and stuff from them trying to stick me. Finally, and it's just I guess this leads into some of the stuff I know it's on your heart is, the nurse came in, they were doing a spinal taps and stuff like this. A doctor came in and tried. Finally, they just called an anesthesiologist. He came in the room, was like, guys, you're doing this wrong. He bended me in a certain way, stuck the needle in, got the fluid, and was done in like 5 minutes. And I'm like, seriously, I went through all this pain, all this struggles because somebody didn't know what they were doing, right? It was, so I didn't have a lot of faith, I guess, in the medical community in some sense. There was this torn of, I think, they can help you, and I think it's really cool when you find doctors who are really looking for answers. And then the other side was, man, sometimes they just really mess up, right? And what do you do? Because we have, and I think I gained it from, I think mom and dad, that like that generation, right? They have this unquestionable faith in the doctors. Like when the doctor says it, it's law, and don't question it. Even though you and I know, all you have to do is go to another doctor, and that other doctor may have a totally different opinion about it, right? But they just didn't grow up in that culture. It was like you went to the doctor, he knows everything about your body, he knows everything about nutrition, he knows everything about medicine. They just know it all, right? And so if the doctor says this, you do this. If the doctor says get that test, you do that. So I would say that was probably my first exposure. But then I remember watching, you remember the show House, right? Is that what's called, right?
Yeah.
With Dr. House, right? And it's like, man, where are the houses of the world? Like, where are the doctor houses where they really like? I mean, I know he had totally bad bedside manners, but
yeah, we'll dive into that part because that's an interesting part of the whole healthcare world.
Yeah, so I just but for me it was more the people just looking for doctors just looking for answers instead of just trying to like now it's just a quick fix, like how can we fix you, get you out of here kind of thing,
Yeah.
So how have you seen it change over these years?
Well, I think when I came in again, I mean, I was 19 coming into this world. And again, I worked in inpatient rehab. So we had everything. We had, nurses, we had nurses' aides, we had, we had doctors, we had specialists, we had internists, we had physiatrists, which is a doctor that specializes in physical and medicine and rehab. And they're the docs that usually take the lead in a rehab hospital for recovery. We had social workers, we had speech therapy, occupational therapy. So we had a lot of different medical professions right around us, and I learned a ton. And I worked there for like 23 years. So, I mean, I've been around it a lot and saw a lot of different things. So I think when I came in, I believe, again, I didn't really know much about healthcare. I just was coming there for a job. I think it was when the HMOs were starting. So it was like early 90s, and the whole HMO world, I think, is what started to change from fee for service to now this HMO program. So now all these different healthcare benefits changed, and people had co-pays they never had before, all these different things. So that part of it started to change there. And I didn't really know much, honestly, about the insurance side of things. As I got older and got my first job and got my healthcare benefits and started to figure out what they were and how that worked. And, being pretty healthy, we didn't go to the doctors very much. So then you start finding out, okay, you have this copay, or you have this co-insurance, or you have this deductible. And again, these are all terms that are very commonplace in every single medical policy, but most people have no idea what any of that means. They have no idea what their policies are. And I can say that firsthand because I check patients' benefits, insurance benefits every day for the patients that come into my practice now. And I have to because I need to know what I'm going to be responsible for collecting from them, what they're going to be responsible for, or what all the ins and outs are of that insurance plan. So I've been in private practice 18 years, so that's when I kind of started diving into figuring out and learning all the insurance ins and outs. Because in a rehab hospital, I didn't have to worry about any of that stuff. They had a whole
Yeah, yeah.
department that took care of that. So for me, what I started noticing in the 18 years I've been doing it is things have changed over the years. When I first started, I mean, people would sometimes have a $10 copay. They'd come in, that's all they had to pay every time they come to see me, and the insurance pays the balance. Um,
So
some
you didn't
people,
question it,
no, they
right?
didn't really question it. But the thing
No.
that's funny too is like, there was a lot of people in the beginning. And again, I was new at trying to figure out what information I needed to obtain to know what they needed to know. And it was so funny because in the beginning, like I would tell people that and they would argue with me. And I'm like, I'm sorry, this is your insurance benefit. I'm not making this up. I'm not saying I'm going to collect X number of dollars every time. Your insurance has designed that. And you may not be aware of it, but that's what your insurance benefit is. Or there'll be times where people, they only have 20 visits of physical therapy a year, and we max them out, and they're like, well, can't you just ask for more? Can I get another script from the doctor? Like, no, your insurance benefit is your insurance benefit. It doesn't change. And so a lot of conversations came on early about trying to understand, like, helping the patients understand their benefits and trying to walk them through a little bit more of like, you really need to understand what your health benefits are as an employee or a spouse or whoever's getting the benefit. And most of the time, I don't think they're going back to their HR department to find out, hey, what are my benefits actually? You just sign up for a plan and you get a couple options and that's the end of it. So that started like, there was, pretty average copays and that kind of stuff. So I'll just kind of break down a little bit of this for the listeners in case people don't know. So three major expenses on most health plans are a copay, which is a standard fee. That is, you go to your doctor, it's $20. And every time you go, and that's a little outdated because they're way higher than that now, but you go to the doctor, every time you go to the doctor, you pay the $20. Your insurance takes care of the rest. Then there's a co-insurance, and the co-insurance is a percentage of what the insurance is. So if your co-insurance on your plan is 20%, that means your insurance is covering 80% of the bill, and you're responsible for 20% of it. Now, I'll get into this for just a quick second. I'll try not to get too out of hand with this stuff. And then the other piece is a deductible. And the deductible is what is your responsibility that has to be paid out of your pocket before the insurance will even kick in to start to pay. So if you have $1,000 deductible and you go to the doctor and they say, okay, that was a $300 visit, well, your insurance isn't going to pay the $300. You are, because you have $1,000 deductible. So not until you pay out of pocket that full $1,000 will you then go to the doctor. And now, if there's no other expenses, no copays or no co-insurances, you now would be covered by that visit and wouldn't have to pay anything. And there's a lot of other nuances into this whole thing. But that's just kind of a brief overlay of kind of how these plans work. So what I saw changing was, and again, I'm not trying to get political on this. It's just strictly an observational piece. When Obamacare started, things definitely changed. That was like 2008, 2009, somewhere in that world. maybe 2010, I guess, by the time they got things instituted. I actually forget the date. But all I know is I started to see people who had either no or very, very little deductibles started to skyrocket. So if you had like a $500 deductible, all of a sudden now you had $1,000, $2,000, maybe $3,000 deductible. So they started to climb. The other thing I noticed was the co-pays started to climb as well. And they could go from somebody who had a 10 now might have had a 40 or 30, some went up to $50 co-pays now. So that's a traumatic change to the insured now when they go to a doctor, because now they have to pay out more out of their pocket without the insurance coverage. So, I mean, there's a whole world of the health savings accounts and all those kinds of things, all the different,
But
employers.
that was created because the deductibles are getting outrageous and everything else. So it's like, oh,
Right.
what are we going to do? Well,
Right.
let's give them a benefit. Let's
Yeah.
let them, save some for their medical bills, right? It's weird. It's almost like they did in the insurance companies did like a switcheroo, because when we were growing up, our parents had what they would consider major medical. So if you go to the doctor, they didn't like taking us to the doctor because it cost money. But let's say back those days it cost $25 to go to the doctor, right? They paid out of pocket. But if you went into the emergency room, if you had to go in for surgery, if something happened, that was considered major medical. And then you had a slight deductible, which is not very high, and then they would cover everything. That's my understanding of it for mom and dad and how they used to share it.
Yeah.
So you were spending, oh my goodness, back then they were probably spending, 100 or maybe $200 a month, right? For a major medical policy that was there in case something bad happened to you, but in normal everyday going to the doctor. And it's almost like they pulled this HMO thing to do a switcheroo where there's like, oh, well, now you go to the doctor for only $10. Isn't that great? And in the meantime, what they were doing was bumping up the deductibles, increasing the insurance rates. And now it's almost like it's flipped where, okay, if you pay us, and most see what I've been on the other side where, most employees do not understand how much their company is spending on medical insurance, because they only see, oh, I only paying $200 a month, or I only paying $400 a month. Yeah, it's a lot of money. It's gone up. I get it. But they don't see the side that their employer is paying, right? And when you're self-employed and you got to pay for health insurance yourself, I mean, we were on a policy, and this is 3-4 years ago. It was $1,600 a month. $1,600 a month with a $7,000 deductible, meaning you're paying $1,600 a month if you go to the doctor and you go to the doctor and you go to the doctor until you get up to $7,000. They didn't pay a dime.
Yeah.
It was like, wow, oh my goodness, it's just insane. So it has radically changed. And it's obviously it's hurt you guys that are in the profession that have to go through these insurance companies.
Yeah, and again, I don't mean to take the whole time on this insurance thing, but I think it's kind of important to dive into a little bit before we kind of move forward. But the other thing that most people don't realize is that every insurance has a fee schedule. So like as a provider, you have to provide a fee schedule. Like my services are worth X amount of dollars. Now I could, make them 8 times what I think they're worth, and that could be my fee schedule. Well, that doesn't really help me any, because what happens is your insurance company decides what the allowable is worth. So if I say, X number of dollars is what it's worth for an hour of physical therapy, they might come back and say, well, we're only going to allow you to collect a third of that. So that means if you're billing a patient and they have a $20 copay, well, we're only going to pay you the other balance of what we have decided is the third of what you think you should be charged or should be paid. So the allowables are really what drives everything. So, people are really into looking at their bills and their explanation of benefits, or EOBs they call them. You'll see that everywhere on a bill. You go to the hospital, you'll see, the ER visit itself might be, $8,000 for the visit. They'll break everything down. And then you'll see what the insurance actually allows them to collect might have been $2,000 out of that 8. So like, there's the problem is either we need to balance off what's allowable and what is actually a usual and customary charge, which is what we're all told to come up with, is usual and customary for what my services are worth. Now, I don't know who's deciding in the insurance world what a service is worth, because I don't think half the time it's a person in that profession. Like, I don't know that physical therapists are deciding what my physical therapy charge should actually be worth.
Plus in your area.
Yeah, yeah,
right?
it has
I
to be.
mean,
Yeah,
yeah, I mean,
that will interact with it too. So like
yeah,
residential areas will be a different rate based on that area as well.
yeah. Now,
Um,
what amazes me, like, and I'm no CPA or anything by any means because I'm not a good numbers guy, but I'm just thinking off the top of my head, like, okay, if they charged, if you were billed $8,000 by the hospital, right? And the insurance company says, oh, I'm gonna pay 4,000. Now the hospital is taking a $4,000
exactly,
loss, and I
exactly.
bet they write that off on their taxes.
Yeah,
So
and I've
it's all
thought
a
that too.
numbers game.
It
You
is,
know?
and what's kind of wild is, how much can you write off? You know what I mean? Like, so if you're taking an average hit of 50% on what you charge and what the insurance allows you to get paid on
Yeah.
every single patient, you're writing off a lot of money. So I don't know
Yes.
if they're making out better that way, and that's why they do it rather than having
Probably.
a
They're probably
rate.
paying
So
for very
well,
little
here's the other
taxes.
thing that happens a lot of times too. So if you have a higher rate and your insurance is only going to allow you to collect, like, let's say a quarter of what you're actually billing, what happens is if people don't have insurance, here's the kicker. They can go and bill that patient the entire 8,000 amount.
Yeah.
Now, if they don't have insurance, chances are they're not going to be able to afford to pay $8,000. So I guess they're still not going to get their money. But in a case where there's like a personal injury case, or there's a legal case, or a workers' comp sometimes, or a motor vehicle accident, sometimes those cases will pay out the full amount. So I think that's why some providers keep their fee schedule or their charges way higher because they can recoup that in those type of situations.
It's just,
So
it's just
it's a wild game. It really is.
now you want to get crazier. So as you know, like I've had MRIs through my health situation, which I talk about. And so doctor wants to do an MRI every once in a while, and I'm like, well, I don't know what's going to cost me, right? So I remember, I called up because I wanted to make sure, okay, and I think that year my deductible was, I think like 2 grand. Let's just use that as the number, okay? And so I'm like, okay, if I do an MRI, I have to pay $2,000 out of pocket to get an MRI because the doctor wants me to get an MRI, right? So I'm like, well, wait a minute. Sometimes the hospitals will take X amount of dollars based on what the insurance companies will call. So I call the insurance company and say, well, what will you pay for, will you pay for this procedure? Well, we don't know what the hospital will charge. And I'm like, okay, so let me call the hospital. So I call the hospital. I said, okay, so what will you charge for the MRI so that I know, like, will you guys write off so I don't have to? So if let's say the MRI is $4,000, right? And the insurance company is willing to pay you 2,000, will I still have to pay my deductible, or does that get written off in that other 2,000? Does that make sense?
Yeah.
Right? So I was basically trying to find it out. Well, the hospital could not tell me what the MRI would be until I actually did the MRI. The insurance company would not tell me how much they would be willing to pay until the hospital bills them for the MRI, until they can come to a number that they agree upon after the procedure's already done. And now I'm stuck paying the bill. So guess what? I told the doctor, sorry, not getting an MRI. I said, if one of us goes in the hospital with some kind of weird thing and we paid off our deductible, I'll call you up. We could go get an MRI, right? It was just ridiculous.
Yeah.
Now, on the flip side of that, so we know, okay, let's say an MRI is like 3 grand or whatever. I don't know what because I know you probably send patients for MRIs too once in a while.
Yeah, I mean,
Um,
having some personal experience too, I think it was around that.
yeah, that's why I
Yeah.
say about 3 grand. Okay, so,
Yeah.
um, but here's a kicker going back to people who don't have insurance. So, a friend of mine who's in the medical field too, similar to a little bit alternative medicine, okay, s- called up the local MRI facility next to him and said, listen, I'm going to be sending patients to you because I'm a cash only basis because I don't deal with insurance. So I'm going to be sending some patients to you for an MRI that are going to be paying cash. What would they have to pay for cash, right? And the amount was $350.
Wow.
And I'm like, that's insane, right? So anyway, it's a mess up system, really messed up.
It is, and again, going back to just, the health benefits again, I'll just leave this here. We'll move on from the health benefits part. But again, like you said, I mean, I was as a self-employed, you know, uh, person, I had to cover my family, and I think the last time when I was paying traditional insurance, I've changed and I do something different now, but traditional insurance, here's what I had. I live in Jersey, I work in PA. I had a PA option for several years that was better. Then they shut that down, so I only had an option in New Jersey. So I was allowed to get health care in New Jersey for my family again, which was more expensive. And at the time I was getting this, it came down to basically out of all the insurance companies and all the policies in New Jersey, I was given two options. That's it. So as a self-employed person, I didn't have unlimited options for health care. I had two and chose one of them. My plan was $2,400 a month, and I had a $6,000 deductible. So for a
Wow.
healthy family, we're paying out a ton of money for a premium every month, never using it because we're healthy, and had to pay every time we go to the doctor because we had a $6,000 deductible, which we would never meet in a year unless we had something massive and
Something
major.
major.
So, I mean, it all depends on the policies. And again, I will say this. When I had traditional insurance where I was working for someone else, having my son in the NICU for 99 days, that bill was almost $1 million. And thank God insurance did cover that. So, I mean, there are some benefits to it. That was before I knew other things about it. But yes, I mean, I don't want to poo-poo everything about insurance, but I would say this is just be very careful to understand your policies,
Mm.
know that there are options out there, and try to understand as much as you can about it. That's all I would say. So,
Yeah,
so
so you know what
we'll
you're getting
kind of
into.
dive, yeah, we'll dive a little bit more. I mean, really, the topic we wanted to kind of get into a little bit more was just what's happening with healthcare. So the insurance is definitely one side of things, but I talked to a lot of patients, and I think this kind of came to my heart the other day when I was talking to a patient, and I've had this discussion so many times over the years about patients who, they're all about, hey, I just want the top doctor. I want the top surgeon. I don't care what his personality is. I don't care if he's mean and nasty. I just want to know that the best guy in the country is working on whatever they need to do for surgery for me. So
Hmm.
my point of this was, why can't we have the best of both worlds? And it kind of really hit me. I guess I got very passionate about it because I'm very passionate about what I do. I want to help people, and everybody in healthcare should have been getting into this profession for the same reason. Sure, there's lots of
Yeah.
dollar signs out there. I understand that. But the bottom line is the primary reason we should all be getting into the healthcare profession is to help people because that's who we're dealing with. Now, if you don't have a good interpersonal skills, but you're amazing in your brain, then maybe use those skills, but go do research. We can always use research, but maybe you're not cut out to actually talk to and be engaging with patients. And again, I don't want to knock any doctors here because there's a lot of amazing, amazing doctors out there
Yeah,
that have
absolutely.
great personalities that do a great job at what they do. And I've met and been around a lot of them. I've also experienced some that are just cut and dry and there's no personality. It's just here's what it is. And I know I could do a good job in fixing your leg or fixing your arm, but other than that, I'm not really concerned about how you feel about this whole process you have to go through. So I think there's a good and bad to that. Again, for me personally, if it's me that has to go get a surgery done or have to deal with doctors, I want to know that there's a great doctor who's very skilled, but also has some interpersonal skills. An
Yeah.
example I was trying to give this patient as she was kind of talking me through this was, imagine your mother, your loved one, was diagnosed with cancer, massive cancer, life-threatening cancer, and you are seeing the top oncologist in the country, without a doubt, the best person you can see. And that person has zero personality on how to deal with people, comes in, just tells you, here's the deal. She's probably got 6 months to live. It's inoperable. We're just going to treat it. Take care. And I don't think that's unrealistic to know that stuff like that happens. So now you're left with, nurses who are much better at that interpersonal care stuff. They're just designed for that. You got PAs, you got, nurses aides, all those different people that can help kind of come around that. But at the end of the day, who is the family looking at with that diagnosis? They're looking at the top guy or woman who they went to get this answer for them. And that person just told them bad news and walked out the door. And again, the nurses can come around all they want, but that family is still going to be looking at that doctor. So again, this is all my opinion on it, but I've been around enough of it and seen it. And I really do think it can be the best of both worlds. But I think here's what's happening is that in a lot of cases, our healthcare industry is just diminishing because, if you go to the doctor. I mean, again, there's a lot of great, amazing doctors out there. And I don't really fault the doctors. I guess I would say I fault more the medical community and again, going back to the insurance community. because I think a lot of doctors get in this profession for the same reason. We want to help people, we want to be compassionate with them, we want to get them through their situations and do the best we can. But the system is what's broken, and the system doesn't allow them to do that anymore. It's all a
Nah.
numbers game. It's like, hey, how efficient can you be? Can you see 30 patients a day? Okay, great. If you can see 30 patients a day, you get 3 minutes with each one, walk on to the next one. Well, what can you do in 3 or 5 minutes? And
Yeah.
honestly, again, a lot of experience here, a lot of patients that go to a lot of specialists. They tell me, I saw the doc for 5 minutes, he was in and out and moved on.
Yeah.
And I don't know that that doctor really wanted to do that. That doctor maybe wanted to sit down for 10, 15, 20 minutes and really educate the patient and really talk to them. And again, there are some that will kind of, buck the system and do that. And I can almost guarantee they're probably getting something in their ear later on that they didn't get enough patients during the
Yeah.
day if they've sat down and did that. I know a neurologist who will sit down with patients and just really, really go into things with them and discuss it at heart. And so again, there's a lot of amazing doctors out there. There's good and bad in every profession. I'm not trying to bash doctors. I'm trying to give a better understanding of our healthcare system is broken, and in a lot of different ways. But I think this is the piece of it that this frustrates me as a healthcare professional. I spend a lot of time with my patients. I talk a lot to them about all kinds of different things, and I know I have a different profession than the doctor does. I have more time with them every day when I see them. It's expected to be with me for about an hour each time I see them. Doctors are not, but at the same time, when people are trying to go through something that's very traumatic to them, there's a big emotional piece to it. And if that's not being addressed somewhere along the way, I've
Mm.
seen it. Patients come out, they're extremely discouraged. They're like, I don't know what to do. Nobody's answering me. Nobody's telling me what to do. I can't get any guidance. I've been to 5 different doctors. Nobody can seem to find out what's going on. They just say, there's nothing wrong with you. And again, I've seen it a lot. It happens a lot. And there are a lot of unanswered things out there. But again, I think the time is what the physicians and the medical professionals, the nurse practitioners, the PAs, they don't have as much of that anymore. And I know
Uh,
the world is kind of driving toward the PAs and the nurse practitioners now. And I
yeah.
think they're a great profession and they're a great, adjunct to what the physicians can do. But again, why can't we have some of this? And it's because the system is driven that way. Even in my profession, a lot of physical therapy offices, the PT is the one that has to supervise a PT assistant who can treat the patient just as much as the PT can. We have more schooling, doesn't mean we're any better than them, but we do have a bigger knowledge base to start with. I work with some amazing PTAs, some that are better than PTs. But again, we have to supervise them. In the world of PT, what they've done a lot is they'll say, okay, well, the PT has to evaluate the patients, PTA can treat them. So the PT just treats a patient or just evaluates the patients, hands them over to the PTA. PTAs are less expensive to hire, and they can work with the patients. So again, you're pulling the PT out. Same thing in the dental world. What happens when you see the dentist? How often do you see the dentist? You see the hygienist most of the time, right? The
Yeah.
dentist comes in real quick, looks at you, and they're out. So it's always trying to find this different profession or sub profession within the medical community that we feel like, oh, okay, well, we don't have to pay them as much as the doctor or the dentist or the PT,
Mm.
so let's hire them and let's fan them off to most of the patients and have them be able to spend more time with the patients. So I know, again, it's a money thing. I get it, but how can we make this better? How can
Yes.
we make this different?
It's amazing, and I know, again, I would try and not get politics into it, but unfortunately, you can't avoid it. But something as simple, because it's been brought up a few times about the transparency. If an
Yeah,
MRI costs $4,000 at this facility, and a facility down the street is going to cost you $2,500 because I don't know, maybe there's a little older equipment, maybe they're a lot more efficient at what they do, maybe they run their company better, whatever it is. Now you have a choice. Now the insurance companies have a choice. Like it's a whole different ballgame. But this untransparent um, game that they keep playing is destroying us. It really
yeah,
is because, I don't know. I mean, all of us we look for better prices, don't we? So, you know what? If Walmart's cheaper than Amazon, we're going to go to Walmart. If Amazon is cheaper than Walmart, I'll probably get it on Amazon. I mean, we look at all those factors, and if we could do that in the medical field, it would probably revolutionize it. Again, it's my limited theory, but I just think when you hide the numbers, there's something going on, and it's time that just gets exposed.
yeah,
Um, but one of the things, like you talk about seeing the doctors. I think one of the things I've seen change is that very thing. When I first started having some major medical stuff going on in my mid-20s, um, when I went to the neurologist, the second neurologist I picked, I think he spent over an hour and a half with us that first time, like literally. And it was like, oh my goodness, this guy's really listening to us, and he really wants to find out what's wrong, and he's really trying to diagnose me, and he's not just, oh, hi, how you doing? Okay, see you next time. But that was 26 years ago. Well, actually, now it's, oh my goodness, now it's 33 years ago. Um, but 33 years ago, that's what it was. I stopped going to him probably about 5 years ago. A whole different ballgame. Oh my goodness, he pulls your chart. He remembers me a little bit because I went to him for 26 years, but they don't like it's so quick. It's in and out. It's okay. How you doing? Okay. Yeah. Look, boom, boom. Okay. Let's do this. Here's a test. Let's change your drugs, whatever it is. And they're on to the next patient. It's just amazing how, yeah, just how different it is. And that's not, and the guy I went to, 33 years ago or whatever, like, man, that guy really loved what he was doing.
Yeah.
He really cared about you, and unfortunately now he's in a system that's so broken that they don't even get to do what they love anymore. Yeah, it's
Yeah.
it's a shame.
And
You know,
even,
and
I mean, yeah, go ahead.
I was gonna say, and going into, it hasn't helped us.
Yeah.
That's the worst thing. It hasn't helped us.
Yeah.
I mean, when you look at sickness and illness and everything else going on in our country, we are in worse shape than we were 5 years ago, and then 10 years ago, and then like it's just getting worse and worse and worse and worse.
Yeah. And I think again, again, I hear it all the time. People go in to see the doc, and again, I want to be very clear on this. I am not blaming physicians. Even in my profession, PTs are the same way. There's certain offices, certain companies, you're driven by efficiency records. So how many patients can you see in an hour? Can you see
Yeah.
4, 5, or 6 in an hour? Okay, you're not going to be very effective with the patient. But the PT probably doesn't want that, but that's what the company's telling them to do. So again, it's across the board. But again, it's the system that has to change. I don't know exactly what the answer is to that. That's why we're just kind of discussing this. But when you look at it again, how frequently do you go to the doctor and right away, what is it? Okay, let me write you out this prescription. And I mean, I've even seen that for my kids. You go to the pediatrician, they look at you, they spend a few minutes, and then boom, here's the prescription. Why
Yeah.
can't we talk about this? Do we need to go on a medication right away? Now, again, I'm not poo-pooing the whole medication pharmaceutical industry. I think it's got a lot of problems, which I think we should be a lot more discussing about, and I think we should be a lot more questioning what's happening there. But I will say this, some stats, pretty crazy. 131 million people are on prescription meds. 70% of all adults are on meds. So prescription medication, that is a ton.
That is-
36% of adults are on more than 3 medications.
Yeah.
42% of the U.S. visits the ER each year. So almost half of the country takes a visit to the ER each year. And again, it's who knows what they're going for. It could be multiple, visits or whatever. 34% of Americans have some type of inflammatory condition. And in 2014, 60% of Americans have at least one chronic disease. Now, I'll give you one more stat. Since 2000, so 24 years ago, healthcare costs have increased 121%. So
Wow.
put politics aside, put opinions aside, how about we just focus? Everybody wants facts, stats. Here we go. Let's just have some conversations about this. Why? What is happening, right? So again,
Yeah.
who's driving all this? Is it driven by the pharmaceutical industry? Very easy question, I would think. We all know it's a multi-billion-dollar industry. Now, again, I don't know what everybody's input is on that. All I can say is here's a lot of stats. And I think if you look around, we kind of do have to question, like, okay, why? Why is there all these inflammatory conditions? Well, look
Yeah.
at every commercial that's out there for prescriptions, right? The list of the side effects is way longer than the list of the benefits. Okay, so again, it's kind of got to make you wonder. How many
Yeah.
times can you sit through a game or show on TV? How many ads do you see for prescription medications? There's like
Yeah.
something for everything. Almost like, oh, you got a big toe inflammation? Here you go. You know what? You got a hangnail? Let's take this.
I don't know.
I mean, it's really out
crazy.
of control. It really is.
And when you see these commercials, you watch them and you're like, man, like 2/3 of the commercial telling you the side effects, right?
Yeah, exactly.
And it's like, why would anybody take this drug? I was reading an interesting article, and I don't even remember where it was. I just remember reading this article, and it was talking about that. It was like, why do the pharmaceuticals bombard you with all these commercials, and why do they give you all the side effects? Because they're basically numbing you, so that when the actor says, "Oh, we need to go on this drug," and you remember, "Oh, but that has this side effect, this side effect, this side effect," and you're like, "Oh yeah, but they all have them." So you become numb, like, and you don't even question it, Not that depression medicine you could be on that you think you need, which may you do, like, causes depression,
Right.
causes suicide thoughts, and
Yeah.
you're like, oh my goodness, why would I go on this thing? That makes no
Yeah.
sense to me at all.
And again, I'm not anti-medicine. I think there's a lot of medications that are necessary to help with different situations. I mean, one in particular, and I've had, again, this conversation with several people, is the cholesterol medication. Somebody comes
Yeah,
in and they have a higher cholesterol on their blood work. Well, I don't know. Again, every doctor's different. I don't know what standards they go by because every doctor is different. But
they don't.
what is the first thing? Let's put you on cholesterol medication.
Yeah,
Not let's talk about diet and let's modify things for like 6 months and see how things are again. Then we can talk. It's like right away, let's put you on this.
right.
And again, I think what's interesting is that the world of pharmaceuticals has changed drastically because now the patient's becoming a consumer. There's these ads are inundating them. They go to the
Yeah,
doctor and say, hey, I want to be on this medication because I saw the commercial. Can you put me on that? So again, it's like now we've just shifted everything. Like if the doctor's supposed to have the knowledge and they may or may not prescribe what the patient is asking for, the patient's now coming in saying, hey, I saw this drug. Can I take that instead? So
yeah,
it's really kind of bizarre. And again, I don't know, it's every doctor's different, right? So
right.
again, I know a lot of good doctors that are diving more into let's talk about some other options first. Let's talk about your diet. Let's talk about some things we're eating. Again, family history plays a big role in a lot of cardiac diseases, a lot of respiratory diseases. So if you have a big if you have a big family history, then sometimes you can't avoid that. You're at
Mhm.
risk because of your family history, not from anything else. But if it's just from, your health and your diet and your makeup, could we modify some of these things? Could we try to lose some weight? Could we try to eat differently? Could we try to cut things back and see if things change in our blood work that maybe I don't have high cholesterol now, maybe I don't have high blood pressure right now, or maybe I'm not pre-diabetic because now I've changed my eating habits and now I don't have to.
Yeah,
So, I mean, it's an interesting world. I think, a great example for us too is our own mom. Again, there's a lot of
yeah,
the medical world that's just stuck in. I just talked to another patient today. She's been doing the same routine for pain management, getting shots in multiple areas in her body for 20 years. No change in pain. She has no change in
wow,
pain. She's got a bad shoulder, she's got bad knees, she's got a bad spine. She's been going to a pain management doctor for 20 years and getting injections for 20 years, and she's not any better. And here she is 20 years later, still has all the same pains. Our mom had chronic respiratory issues.
yeah,
I don't even know how many years she was treated. I would say at least probably about 15 by the same pulmonologist. Gave her the same treatment every time she went in, every time she had an episode of a breathing issue or had asthma attack or had, pneumonia kick on. What did they do? Prednisone, prednisone. She was on prednisone constantly. And if you really
yeah.
dive into prednisone, that is a terrible drug to be on long term.
I
And
know.
she was on it long term,
Yeah,
probably almost consistently for probably at least 10 years.
yeah,
I remember one time when I got frustrated with it, and I actually called her doctor and I said, can I please speak to the doctor about my mom? And unfortunately, it was his partner that was seeing her at the time because her doctor was out of town. So I asked him, I said, can you guys is there anything else that you can come up with? Like you've been treating her the same way. Is there nothing that triggers to say, okay, this isn't really changing anything? How about we critically think again and let's try to figure out, is there something else we can do? Can we change this? Can we change that? Can we offer her something else? And when I asked him that, what he said to me was, if she was my patient, I probably would try something different because it's been so long. But she's not my patient. I'm just covering for the doctor. So
yeah.
therefore, I can't do anything different. So
And we
again,
took
here
it.
you have somebody that probably wanted to possibly change things
Yeah.
and didn't. And, here's where we are.
It's yeah, it amazed me. I mean, it takes something as simple as how many, actually, I was looking at a statistic too. 75% of Americans are dehydrated, right? And dehydration alone leads to so many
Yeah.
problems, like inflammation, right? Which leads to so many other problems, right? yet a doctor doesn't even ask you, how much water are you drinking? Right? Just
Yeah.
something so simple, right? And the older we get, the more of a problem it is because the elderly are not drinking a lot.
No.
That's
No, I
become
see it
more
all
and
the
more
time
of a
too.
chronic
Yeah.
problem. Yeah.
Mhm.
And again, it's just really simple stuff that like it's almost like basic nutrition 101, and we're not even
Mhm.
talking about it as a culture, really,
Right.
right? I mean, yeah, we faced the well, what was portrayed as the biggest epidemic we've ever gone through. Um, Nobody even talked about health through that. Like nobody ever said, "Hey, did you know that those who had vitamin D or were taking vitamin D had less episodes or not even any?" Or people who are hydrated. Does anybody even talk about? Like we don't even talk about it. It's
Yeah.
amazing how much we've pushed aside like simple nutrition.
And
You
I
know,
find so often I talk to patients every time I see them, about nutrition. Like, are you taking any vitamins or supplements? And, some are, some aren't. Some say, well, my doctor has me on this, or, my blood work showed this, so they want me on this. And again, lots of knowledgeable doctors out there. And there's some that really dive deep into nutritional aspects. And I applaud them for that because statistically, physicians
yeah,
average about 21 hours of education on nutrition in their entire medical school
which is crazy.
education.
Yeah,
And they're ranging anywhere from 3 to 56 hours. So imagine a doctor with all the knowledge they have, they're given 3 hours, maybe, hopefully more than that. Let's even say the average 21 hours of nutrition. Well, guess what? If you've had a practicing doctor for 20 years and they haven't gone into any other nutritional aspects themselves for any continuing education or whatever else they need, their
yeah.
nutrition knowledge is very outdated. So, and I would say that's probably the majority. Again, I don't really know. I know a lot of good doctors that are really diving into it. And I know a lot of doctors that will say, I don't really know much about nutrition.
Which is
Um,
nice for them to say it too.
yeah,
I
love
appreciate
that.
that.
Yeah, instead of pushing
Yeah,
someone in the wrong direction.
this
Yeah,
is my limitations. I just don't know a
right.
lot. But it's amazing, again, society, like when anybody talks about nutrition, it's like, oh, we should go to your doctor and ask them about whether you should take these vitamins
Right,
or not. It's like, but they don't know. I mean, it's like
right.
asking your auto mechanic, should you get brain surgery? Like they don't know. It just doesn't make sense, but we do it, because this mindset, right? So yeah, it's amazing how much simply we're under under nu, nu we're yeah, malnutritioned, right? We're
Malnourished. Yeah,
yeah, malnourished as a society, and it's just it's wreaking havoc on us really as a people. We are one of the most messed up countries medically, and
mm,
we should be right on the cutting edge of everybody being healthy. You would think for all the billions and billions and probably trillions of dollars that are spent on medical stuff every year, right?
mhm.
And we're not getting better. There has to be better solutions, and
And again, there's so many factors. I mean, there's the pharmaceutical world that may or may not be harming certain things. There's the food industry that
oh yeah, we
may
spent
or may not be.
episodes on
I
that.
know. Yeah, so that's, I mean, again, these things are like, let's just ask questions. I mean, we don't learn
Yeah,
much
yeah,
unless we ask questions. It's not wrong to ask questions. It's where you become more knowledgeable. It's where we can have better conversations and discussions is by asking questions. If we just sit back and say, well, my doctor said this, or so and so said this, or this medication's supposed to work. Like, ask the question so you can be a better consumer of your own health. And that's really the bottom line is you have to be a better consumer of your health because you only get one body
yeah,
and you got to take
yeah.
care of it.
I think that's one of the shifts that really needs to happen
Yeah.
in all of us mentally and practically is we have to realize we are our best advocates for our own personal health,
Yeah.
and we should not rely on anyone else to do that. And it doesn't mean we can't seek advice from a doctor or a specialist or anything like that. But again, each of them come from different schools of thought as well. So unfortunately, we have to take that ownership that this is our body,
Yeah.
this is our health. Are we going to do the research? Are we going to look into this and other options, and make some good decisions based on ourselves instead of depending on one person or two persons out there that are making decisions for us?
Yeah.
Yeah.
Yeah. So as we're starting to wrap this up here, let's just let's dive in here a little bit to our own mulligans in the world of, I guess, health, healthcare. Um, I guess I'll start first, Ken, and I'll let you go. So for me, I would say probably the biggest mulligan that I took was starting my own practice. And
Mm.
big, and I know I talked about this in a previous episode, but from this standpoint, it was really mostly again because I wanted to be able to take care of the patients the way I wanted to. I wanted to be able to have time with them. So I have a setup and design in my office that allows me to do that. I can spend time with patients. I can ask questions of them. I can talk to them about different things. And believe me, we talk about a lot of different things. I mean, I get all kinds of questions from patients when they're asking about their health care and stuff that doesn't even have to do with physical therapy, and we're discussing it. So having the autonomy to be able to do that, again, I am hampered by the insurance industry. Unfortunately, it's not optimal, the way the insurance industry runs for our profession. But having that knowledge to be able to sit down with a patient, discuss things with them, or put things aside for the reason they're here because we need to talk about something else regarding their health or their fitness or their wellness. It's really important to me, and it's amazing. It's an amazing blessing to be able to do that. So that is probably definitely the biggest mulligan I was able to take, was being able to do that, do everything on my own the way that I want to be able to do it, to hopefully maximize the benefit for the patient the best. So
Mm.
Ken, you
Gotcha.
have a pretty amazing story. So why don't you share that one with us with your help?
So my story goes, boy, we could spend a long time on this, but I'll try to keep it a little short tonight. But yeah, so coming out of, I think a childhood of one thing after another medically, finally somewhere, or I guess say finally. So it was I was 20, I think it was, what is it, 26 at the time, 27. Um, we were just married. My wife Julie and I were just married. We had just had our first child. So this is like 3 years into our marriage now. And I woke up one morning with, like, it was like somebody drew a line down my body and half my body was numb. And it was the freakiest thing ever. Like, it was like, oh my goodness, what happened? And I'm thinking, like, a toothache. Like, could a toothache cause that? Like, I don't have a toothache, but could that do it? I also had a massive headache, and I don't get headaches. And so, you know, called the doctor, said whatever. They look at you. It's like, I don't know what. Went away. A couple weeks later, happened on the other side of my body, same exact kind of thing. And they ran some tests, and he said, there's some ideas. He said, so to make that whole long journey short, basically about 4 or 5 months later, I was diagnosed with multiple sclerosis. And on the onset of that was horrendous. I mean, it really was. This goes back to, talk about some of the doctors too, because I remember, they said, okay, well, if this onset comes back, we think this is multiple sclerosis, we're going to put you in a hospital and treat you. Okay. And I'm like, okay. Like, I didn't know anything about MS. So you're oblivious to, like, I don't know what it is. I don't know what happens. So you're trusting the doctors, right? And I remember the doctor said, you're going to put you in a hospital. And so he put you in a hospital. Go back to those steroids that you're talking about, the prednisone, right? So I went in a hospital and he put me on morphine. He put me on muscle relaxers, and he put me on Solumedrol drip, which is a high dose of steroids, for 3 days. Actually, I might add even a fourth day in the hospital. I don't remember. I was pretty out of it. I was pretty loopy and everything else because I was on all these drugs. And I went in there with a really minor numbness. But he's like, oh, this is MS. We're going to, kick this in the butt kind of thing. And I was like, okay, whatever. And so they released me at the hospital at the end of the week. And, here I'm like scared. Like, what does this mean to my job? I'm the sole supporter for our family. We now have one son. Julie's home, staying home with our son, Jason. And so we come out of the hospital trying to regroup. Okay. By like Monday, I couldn't walk. Like, it hit so hard. And I'm like, oh my goodness, what? And by first I was like, what did they do to me? Like, I was not this bad when I went to the hospital. What did they do to me in there? Like, what's going on? And fortunately, I was able to get into another neurologist. And again, I went to the big boys, right? So here I was with a local doctor, and it was like, okay, just get into University of Penn. And so we went to University of Penn, met with this doctor. And again, this doctor was amazing, spent a lot of time with us. We're in tears, we're scared, we don't know what's happening. And he basically just reconfirmed. He said, listen, the doctor, he diagnosed you right. He said, here's the thing. He probably just pulled you off the meds a little too quick. Everybody handles this differently. So we're going to put you back on all this drugs. Actually, he didn't put me on any of the drugs but the steroids. He said, we're just going to give you a steroid. I think he started to drip again. And then we're going to taper you really slowly. So that was my onset of multiple sclerosis. And for those listening who don't know what multiple sclerosis is, it's an autoimmune disease. A lot of things could trigger it. They have no idea what. Here's the thing about MS. They really don't know a whole lot. They don't know what triggers it. They don't know what causes it in people. They say it's not hereditary, and yet it runs in families. So there's like so many unknowns. They don't know what it's going to do in your body because everybody's different. And some people get it really bad. Some people don't get it that bad. Some people have what I had was called relapse remitting MS. And it's just crazy what it's like. And so basically what it ended up transitioning into my life was I'd go through 2 attacks a year, and they would come on. I would feel it in my left knee. It was crazy. My left knee would be a little numb and hurt at the same time. And if that lasted more than 24 hours, I knew that this was starting an MS attack, and I didn't know what it would look like. And and so that fear would just overcome you. Is it going to be bad? Am I going to be able to walk enough? Because I never couldn't walk totally, but I didn't have strength in my legs at times. And so you went through it. And I was working at a print shop when I early onset of that stuff, and they were really good with me, let me sit down, all that kind of stuff, going through it. And so then the attack would last 4 to 6 weeks, and then you start coming out of it. You start coming out slowly. All of a sudden you wake up and you're like, okay, I'm not hurting that much. I'm not, and sometimes it's because the drugs finally have tapered off, and now you start to, okay, what's my body really feel like? What am I going through? And then you slowly start to get your strength back. And you started, I had a lot of fatigue, a lot of pains, actually pains and numbness at the same just weird. I still remember my legs being like cold at times, cold to the touch. And yet it's like summertime, warming out, And so we go through that. And then again, once it was over, it was like, okay, now life's back to normal. And, we did things with the kids. We hiked, we went to amusement parks, we did all those things with the kids and stuff like that. But you never knew what was going to hit. And so here, every fall and spring, somewhere in that mix, I go through another episode. Some were not so bad. Some were really bad. And that was life for 26 years. I was on a daily injection for pretty much daily injection. Eventually it became a three time a week injection of a drug called Copaxone, which is supposed to slow down the episodes of MS, hoping that, over time that it won't get as bad as it could possibly. And so that's what we were thinking. And so that was life. I was up to almost 200 pounds back then. I was hitting, my highest was 198 that I got up to. And a lot of it had to do with steroids, because when you're at steroids, you like eat all the time. And now there's some good sides of the story, and some of that, Brian, and we'll share that sometime. But then what changed? I feel like, yeah, it was definitely a mulligan. I mean, this is huge, because a friend of mine called me up, said, Kenny, you got to look at this company. And I'm like, and I remember like, no, I don't need another company to look at or something. And we had done some other side work together. And he's like, no, I want you to look at this for nutrition. And he knew that I had MS, and he knew I'd struggle with it. And he's like, I want you to look at this company that produces your own personal vitamins. So it's based on you. You're going to answer some questions, and it's going to produce your own line of vitamins. And I'm like, okay. And I didn't understand it at the time. I didn't understand what it all entailed. Now that free assessment includes over 14,000 peer-reviewed studies, and it compiles all that information to give you what's out there based on you, of what you should be taking, natural supplements, right? Again, that the company produces. And so I remember going through this, and at the end of the assessment, it spit out my vitamins, and I'm looking at these vitamin lists. I'm looking at the price at the bottom, thinking, and I don't know what it was back then, maybe $120 or something for a month for vitamins. Again, had no idea, because actually I was talking to somebody yesterday about vitamins. They were like, man, I spent $50, I think that every 3 months just on one vitamin. And I'm like, oh my goodness, that's all one vitamin. Like, he's like, yeah, yours is probably cheaper. I'm like, oh my goodness, it's totally cheaper. But so here I'm looking at that price. I'm like, it's vitamins. And so I let it go. I literally let it go. And it was like November, December that year. And I let it go. I told my friend, I was like, you know what? I was like, Rich, you know what? Thanks, but no thanks. And so about 3 months, it was in March the following year. So here's 4 or 5 months later. And I started another MS attack, and it was really bad. And I was having trouble walking. And I called up Rich and I said, hey, you know what? Look, I don't know if this will help. I said, let me try it. And I remember thinking that if this could just take the edge off of MS, if it would just give me some strength going through an attack, or maybe my attacks weren't be so bad, if I was just giving my body some better nutrients, that I would be happy. And I was like, that would, to me, that would be a win, right? And so I'm like, look, so I'll try this, and I'll try it for, I'll try for 6 months or whatever, give it a shot, see what it'll do, because I know it's natural supplements. It's not pharmaceutical drugs. So let me see what this will do. And so here I am in the middle of an MS attack, and no exaggeration, get my vitamins. I put in there in the assessment that I want to take the ones for MS that are recommended again by all these peer review studies. And I'm like, let me try this. And here I am 4 days later. So I started my nutrition on a Sunday. By Thursday that week, I started feeling different. And I know vitamins are not a cure. Okay. I know there's not, some magic potion or anything like that. I just know that when my body started getting the right nutrients that it needed, it started something that was amazing. And I came out of that MS attack really quick. And it surprised me. I mean, it boggled my mind. Here I was. It was a couple months later, and our son Victor wanted to go hiking for his birthday. And I remember him saying, Dad, hey, if you're up for it, I'd like to go hiking. It'd be fun. And the kids, they knew, if I wasn't feeling up for it, you just don't do that stuff. And so I say, no, let's go do it. So we went out hiking, and we hiked 10 miles that day. Like, we literally went out, hiked 10 miles. I was like, this is crazy. I'm keeping up with a 20-year-old, right? And a couple weeks later, it was my birthday, and it was like we went out, we hiked again, and I don't know if we maybe 8 miles that time. It wasn't as bad, but so that was now 7.5 years ago when I started taking good nutrition. I know there's a lot of garbage out there in the market, and people have to be really wary. But I trust this company, and because it changed me. Oh my goodness, But that was the last time I went through an MS attack. So 7 years ago, after 26 years, this is what boggles my mind. 26 years of MS struggles. 26 years on an injection to slow down the disease, right? And vitamins is what changed. Getting the right nutrition just changed my body, and it gave my body what it needed to alter whatever's going on. And again, I know the vitamins aren't a cure, but I know giving your body the right nutrients is what really gives your body the fighting chance. And so a couple years later, it's probably about 5-6 years now, I went off the drug. I went to the doctor, said, look, okay, enough. And there's a little story there, but it was enough. And actually now I don't think I've been back to the doctor in 4 or 5 years. So I pretty much fired the doctor. And again, he was a great guy. But I just don't need them. And I talked about MS in the past because it really feels like in the past. So I feel like I got a mulligan. I feel like I got a great chance to live life. Like somebody rewound my clock 25 years, and it's been amazing. And so now I feel like I'm younger than you are, since we're like 10 years apart here. But now I'm working out, and I dropped, back then I probably dropped about 40 pounds right out of the gate. So I might be back up about 10s around now, as we're fluctuating, but yeah, it's been a real game changer, and so I love this company. I love working with it now, and I'm just amazed of what what God used to put it all together, because I really feel God gave me a second chance, so it's been great.
Amazing story. Amazing story. So as we wrap up here, I would just like to leave us with a couple things here. We mentioned it before. Be your own advocate, okay? When it comes to healthcare, when it comes to your own health, be your own advocate. And again, I tell patients this all the time. You have to know what's best for you. Ask questions. Don't just settle for what you're being told. And not that you're denying what they're saying, but it's okay to ask to understand it better. Because again, in the world of healthcare that's changing, we don't get a lot of time to get answers. So ask questions so you can understand as a consumer of your own health what is happening with you, what are they recommending, if they're recommending something, what does it actually mean, what does it entail. So just be an advocate for your own health. And again, I just want to shout out to the entire medical profession. We need doctors, we need nurses, we need nurse practitioners, we need PAs,
Absolutely.
we need PTAs, we need all these medical professions that are out there. And I am not in any way trying to demean or punish anyone in the medical profession because of that. Again, it's our system. I want to be very clear. Our system has issues. And I think there's amazing people in the medical field, and we need them. So keep doing what you want to do. Keep remembering in the medical community. Remember why you got into this in the first place. And if your system is broken, if the system you work in is broken and doesn't allow you to do what you got in this profession to do, maybe just question it. And if there's no changes you can make in that community, maybe you need to step away and go somewhere else that you can do that. So we all got in this profession to help people. Let's not ever put that in the back burner. And so thanks for joining us. And as a follow-up episode, we're going to kind of dive a little bit deeper into what Kenny was talking about in this nutrition company we work with, and just kind of helping you understand a little bit more about your body and your DNA and how that affects things and the nutritional needs that you need, which can make a huge impact, like Kenny saw. So thanks for listening.
Hey, we know everyone can use a second chance or a do-over, so take a mulligan. Try again. Thanks so much for joining with us today. Make sure you follow us on Spotify, Apple Podcasts, and YouTube. Like, click, and subscribe.